And welcome to my third video about my direct hair implantation experience. In the first video I talked about the preparation. The second video was all about the surgery itself. And this video is all about your own treatment at home after your hair implantation. So your new hair will grow as healthy as possible. So let me just quickly explain how it works. On the back of your head you have a donor area. And in this area you have hair follicles that will almost never die. So move those hair follicles to the front of your head and boom! You have hair on your forehead that will almost never fall off. Whereas the natural hair that is on top of my head is actually dying like crazy. And I'm only 23. Now in this video I will guide you step by step for the right treatment to have a healthy, nice growing hair. So after your surgery you will get your survival pack. In this pack normally you will only have some medication, a saline solution, also a clean white blanket. Oh, there are actually two of them. And you're planning with all the steps and the procedures that you have to follow for your treatment that I'm going to explain right now in a video. So those things that I just showed you, you will get no matter what. But there is a possibility as well to buy a complete pack with all the products of DHI for 100 euros. And I bought that because I wanted to be sure to have all the right products, so I will explain you and show you what the products are. The extra pack consists of 2 bottles of ultra soft shampoos, but actually you can also just buy pH neutral baby shampoo without any alcohol or paraben inside of it, and that's actually also pretty safe to use. 1 soothing lotion spray based on aloe vera for a faster recovery of the donor area. And last but not least, also a pack of Minoxidil for 3 months. Minoxidil is a product that slows down hair loss. Okay, now you know what you need after your intervention, but let me explain you how and when to use all those products. But I will also show you how your planning is going to look like for the next couple of days. Okay, so day 1, the day of the surgery. Okay, the first thing that I personally did after the intervention is to put an alarm every 30 minutes until 10 p.m. Because from now on you will spray every 30 minutes with the saline solution on your implanted area. In my case, it's just here on the front. To make your planning easier, start with an easy hour. If your intervention ended at 2:34 in the afternoon, let's say, well, put your alarm at 3.
And then 3:30, 4, 4:30.
And so on. But you can go up to 45 minutes between each spray. Except at night, you don't have to use a saline solution to spray on your head. So you will have a good night's sleep with a head full of dry blood. No, just kidding. Okay, basically not kidding, it's actually true. So once the bell rings, you take your spray, you take a napkin, and you go in front of the mirror. And then you spray everywhere on the implanted area. Only on the new hair. Of course there will be a lot of fluid falling down on your forehead, so you take your napkin and you just wipe it off. Just like your butt. During the night, try to sleep on your side. But the first night you can just lay down on your back because you will still have a bandage around your head. The first couple of nights I actually slept on the couch. Because usually on a couch you have less space to start moving around with your head while you sleep. Also, your head will lay up a little bit higher when you're sleeping on the couch. And it's actually a very good feeling because you will still feel a lot of pressure on your forehead the very first days after your intervention. Otherwise you can use a neck pillow that you put around your neck, of course. So day 2, continue spraying with the saline solution on your head every 30 or 45 minutes until you go back to sleep in the evening. In the morning you grab your breakfast and then it's time to drug yourself. So basically in the morning you have to continue your medication. The day of the surgery you received some pills to take, so listen carefully. So first of all you take 1 ranitidine, that's to protect your stomach. And then you take 3 prednisolone. 3 prednisolone, which is actually cortisone. But normally everything is filled in your planning on those papers that you get. My doctor recommended me to take them all in the morning during breakfast, so the 4 pills. And so those drugs you have to take 3 days after your intervention. Only during breakfast. But so, the first morning after your surgery, you have to take off the bandage. Make the bandage all wet in the shower and then gently pull it off. If it sticks, just add some more water until it comes loose. If it starts bleeding, don't you worry, it's perfectly normal. Just add a cold compress for a minute or two and then let your back area of your head breathe. And then gently rinse with water without pouring water on your forehead. Once the bandage is completely off, you can start washing your hair with a soft shampoo, but only on the back of your head, only the donor area. Once you finish your shower, never dry your hair with a towel or a hair dryer. Just let it dry naturally. And once your hair is completely dry, you can use the soothing lotion to lighten up the sensitive parts of the donor area. So only use this spray for the back of your head. You can use it as many times if you want, but just don't exaggerate. I would recommend using it like 3 or 4 times per day, and you can just spray like 10 to 15 times on the back of your head. So in day 2 you will have the very first night without any bandage on your head. So prepare the white blanket and put it over your pillow. It will just prevent that your pillows will be completely bloody and messy. The back of the blanket is plastic, I guess, and the other part is like really soft. I don't know what it is, but it's just so baby soft. But just saying, the next day it won't be that white anymore. So, day 3. This is the last day that you have to spray your hair with the saline solution. Once again, take the medication in the morning during breakfast, 1 ranitidina and 3 cortisons. Wash the donor area back again with shampoo and spray the soothing lotion on the back of your head if it's still sensitive. Also, the night of day 3 was the last night that I bleeded on the back of my head. No more blood.
Yay!
Day 4. This is a very important day. You can finally stop with the Once again, in the morning you will take the medication, but this time it will be for the very last time. Normally, all your medication will be completely fulfilled. And from now on, you will also have to wash your hair completely. Normally, you just washed it once every day on the back side, so on the donor area. But this time you will have to wash your hair twice a day completely. So also on the implanted zone, everywhere. Morning and evening. As I told you, day 4 is a very exciting day. Now listen carefully, because you're going to wash the implanted zone for the first time. Now to wash this zone, you just put shampoo on your hands and then you wash with only the top of your fingers in circular movements. And never ever use your nails. And from now on, continue to wash your hair every morning and evening until all the dried up skin and blood crusts are completely gone. For me, it was today the second day that I washed my hair completely, and I still have all the crusts of blood on my head. So it's still totally gross. Every day you can push a little bit more. And don't you worry, the implanted hair follicles don't risk anything. But if you find any difficulties of getting out all of those dried up skins or crusts of blood, just let the shampoo foam rest for a minute or 2 on your head and then gently try to wash until it comes loose. And normally after 10 days you shouldn't have any crusts anymore on your head. Okay, so now you have your planning and you know what is waiting for you for the next couple of days after your surgery. But there are still 10 practical things that I want to explain you, and once I shared it with you, you're good to go. After 10 days you can start using Minoxidil. This product slows down the process of hair loss. So take Minoxidil every morning and evening for a year. If you don't follow these instructions, don't bother using Minoxidil, because it only works if you do it correctly. The first couple of days after your hair implantation, try to avoid salt and sugar in your diet, to avoid an edema to appear on your forehead. It's just a little swelling. If it does occur, don't you worry, just put a cold compress on the top of your forehead. Normally it will disappear in 3 to 4 days. Also try to avoid direct contact with the sun for the next 15 days. But you do what you want. Don't smoke the next 3 days after your hair implantation, and then you can smoke like a chimney again. After 10 days, you can start using the cold option on your hair dryer. And only after 3 weeks, you can use the warm, normal hair dryer. Don't use any hair products like gel or hair coloring the first month. Avoid getting in seawater the next 10 days, and a pool with chlorine you have to avoid for 15 days. You can continue doing your sports 10 days after the hair implantation, but if you're doing an intense sport like fitness, you will have to wait 15 days at least. However, all contact sports or ball sports are completely forbidden for a month. If you want to hide your hair a little bit, you may wear a very large hat after 3 days that doesn't touch the implanted area. Also, if you're driving with a scooter or a motor or just you're a biker, I don't know, you cannot wear any helmet or tight hat for the next month. And basically that's all you need to know. Don't forget to put a thumbs up if there was anything useful in this video. Perhaps this video can help somebody else. I'm your homeboy Gabish and I thank you for watching. Do you want to know what happens next? Just click over there. Do you want to know what happened before? Just click over here. Are you still there? Like, just choose one of those.